Good evening, everybody. This is Dr. Dennis Mariano. Tonight's Transformational Healing Seminar is on how to treat depression naturally using the holistic approach. And the title of the seminar is, do you have emotions that are trapped in your body that are making or keeping you sick? I think you'll find this topic very interesting. Our mission statement is to provide the best technology in holistic health and life care, and also to inspire people to live thriving lives so they can be a beacon of hope for others. Let me share with you our values. Our values, basically, why we do these seminars is because day in and day out in our practice, we see so many people that are suffering, and the reason why they suffer because their worldview violates or is incongruent with natural laws of nature. In other words, if you don't understand how gravity works and you keep breaking the law, you're going to be injured quite a bit. So a lot of people's view of health is actually against natural laws. So we're going to be talking about tonight what we can do to ensure that we can be healthy in a holistic way without having any side effects and harming yourself as you're trying to achieve that health that we all desire. Tonight we're going to be talking about what's called Neuroemotional technique, or NET. And basically NET is a stress reduction technique. It's a tool used by licensed healthcare professionals for many different disciplines. It's practiced by acupuncturists, counselors, chiropractic doctors, medical doctors, naturopathic doctors, therapists, and so on. So each of us that are trained in the NET use it within the scope of our practice in terms of our license. So what is NET? It's an effective treatment for symptoms related to trauma and unresolved stressful events. We'll go into that a little bit deeper. So do you agree there's always stress in life? I'm sure you're not experiencing any stress right now in your life whatsoever, right? No. We all do. I mean, it's never, Rick Warren said in the Purpose-Driven Lives, he said, you're either experiencing a current stress or a challenge, or you're finishing one up, or you're starting another one. And we just have cycles of stress that we go through. It's a part of our life here on Earth. So the question is, how do you respond to stress? Now, there's two types of stress. There's an acute stress response, and there's a chronic stress response. Now, the acute situation is when there's an immediate danger, and what you'll find is that this is called the sympathetic pathway, where the stress is perceived in the brain, and the sympathetic system stimulates the organs like the heart and the lungs, the pupils, the diaphragm, the digestion, and it gets the body to fight or to flee or fight. And the body produces then also adrenaline, and it releases adrenaline and epinephrine to get you to flee or fight. And that's an acute situation, and that should be something that's short-lived, and it shouldn't last you for a long time. So, however, if you have chronic stress that doesn't go away, either that's really happening in your life or you're perceiving it to be, because stress can also be perceived, right? I mean, if you think about a kid that wants something and they can't have it, when there's nothing happening in the moment, they're stressed out. When there's really, it's perceived stress as opposed to an actual stress. So chronic stress is what we relate to doing NET, is that when you have a chronic stress response, what'll happen is that your brain will release chemicals into the pituitary gland, and that releases hormones to the adrenal cortex, and it has effects of stress on the body, meaning the blood pressure increases, the immune system becomes weakened, and then it becomes depressed as well. So chronic stress will actually affect your body in such a way that you're not able to adapt to the current environment, because stress is supposed to go up very quickly and then down very quickly, right? You can adapt, because that's what happens if a bear's running after you. That you shouldn't be running for like 26 miles like a marathon. It's very quick. However, if you have chronic stress what are some stresses what are categories of stress that we encounter? Job stress.
Children.
Kids, especially when they're young, right?
Relationships.
Relationship stress. What else?
Financial.
Financial stress, right? I mean, there's so many things, and guess what? They don't all take turns like, hey, I'll have this financial stress for 1 month, and then when that's done, I'll have relationship stress for a month, so I can just deal with one thing at a time, right? So it's chronic, and the world we live in now promotes that kind of stress. All you have to do is watch the news, right? So many stressful events of today, by the way, can subconsciously remind us of unresolved past traumatic events. So how that works is that they can actually lead to ongoing stress patterns that surface as mind-body symptoms. It actually affects the way your body works in terms of its capacity to heal or not heal. We'll talk about that in more detail. So what NET does, or neuroemotional techniques, that helps us find and eliminate conditioned emotional responses, and stop things from occurring. So you can actually get stimulated from the environment from an old pattern of stress that was actually from the past. So the research now in NET, let's talk about that. So what NET does is it has many kinds of mind-body stress-related symptoms. What's that mean, mind and body?
A combination of both.
Right, it's a combination of both. It's not separate, right? So, because you can't really separate the body and mind, right? It's all one thing. So let's talk about some scientific validation. I don't know if you could see this, but the NET, this is actually on PubMed. This was published in February of 2017. Neuroemotional technique affects the brain physiology in cancer patients with traumatic stress disorder. And what they found is that these patients were cancer patients, and they'd already gone through their treatment protocol. They were told that they were in remission. However, 6 months after, they still, when they think about the idea of cancer or what happened when they were diagnosed with it or the treatment protocol, they would actually have a heightened stress response to be a scale of 1 to 10 at an 8 or a 9. And so they took many of these individuals and they did scans of their brain, and what they found is that in the parahippocampal area of their brain, they could see a stress response. It was actually a red inflamed area that would light up on the functional MRI. And after they did the NET, what would happen is that that area would actually go away. So what we're finding now with the NET, it's not just talking about something where you're talking about in the neocortex. We'll talk about that in a minute. There are different parts of the brain that NET accesses that the traditional psychological counseling alone is not able to go deep enough. And that's why just talking about something is not enough. So we have to go to the different part of the brain to access different parts of the hard drive. Let's talk about the different parts of the brain and their function. So the oldest brain is called what?
Reptilian.
Yeah, it's your lizard brain, is what they say. So, and what it's for is for survival, for feeding, for fleeing, fighting, reproduction, breathing, heart rate. Just kind of like keeps you alive. You know what I mean? Just like you can eat, and like a baby. It's like all primitive reflex. They just don't think. So that part of your brain doesn't think. The mammalian brain, which is the midbrain, has that's where the emotions live, memory formation, sexuality, time. It's timeless too. It doesn't have the sense of time. It's always happening. So that's why when you have these emotions that are trapped in there, it doesn't know if it's yesterday or 5 years ago. It feels like it's now. And then the hormones are the same thing. And this is the mammalian brain. It's the perfectionistic brain. It wants everything to be just right. The brain that we use all day long mostly is the neocortex. That's where you have the issues of reasoning, decision-making, language, spelling, grammar, math, all the stuff that you teach. So, and all voluntary muscle contractions come from there as well. So, a new research paper demonstrating the functional changes in the cerebellum also from doing NET is showing now heart rate response. So not only can you see functional MRI changes in the brain, you can actually see heart rate response as a measurement of stress arousal in the central nervous system. This is listening to the distress cues. What they would do with these people that had the cancer diagnosis that are now in remission, They would put them in a functional MRI tube, and they would have them listen to their own rendition of what stresses them. Think about when you were at the doctor's office. Think about when you get the diagnosis, and that's what would happen. And you could see before the NET, the heightened stress response is very evident. After NET, even listening to the distressing cues doesn't produce a response anymore. And so it allows the body to really be more balanced. Hello there.
Hi,
No problem. Come on in. Have a seat. And so that's what the research shows with regard to the NET. So if you need more information on NET, you can go into the One Foundation.
What does it do to the heart?
It does many different things to the heart. So
I have sometimes a rapid heart rate.
yeah, when you have sympathetic symptoms that way, when you have chronic stress, it actually accelerates the start. Yeah. So if you want more information, you can get on the One Foundation. Okay. So the dynamics of NET, let's talk about this, because a lot of times people don't understand it. You're doing muscle testing and you're talking about things. It almost looks like it's therapy, right? But it's really not. So one of the first primary dynamics is that emotions are physiologically based, meaning you can actually measure these emotions. They're actually minute proteins in the body called informational substances. They're made of neuropeptides, hormones, and other specialized information molecules, and they permeate everywhere in your body. It's in your DNA, and it's been scientifically validated by Dr. Candace Burke. Second dynamic of NET is the Pavlovian response. Basically, the response where it's classical conditioning. You get classically conditioned from your environment, something stimulates you, and it actually affects your physiology in such a way that these physiological responses, usually they're only a one-time event, but your body then starts to do what's called stimulus generalization. It starts to, generalize things, and everything stimulates you. Another dynamic of NET is emotional correlation. They found out about between 1,500 to 4,000 years ago that in acupuncture, they found that different organs actually follow different meridians and have emotions attached to them. And that's very well accepted. For example, if you go to the kidney and bladder meridian, these things are usually associated with the emotions of fear. And the liver meridian is usually associated with anger or resentment, all different types of emotion. Another dynamic is the repetition compulsion. Sigmund Freud contributed this to where he found that when you have been emotionally traumatized at one level of your life, that you will unconsciously want to repeat that same pattern in the future, because that emotion is really trapped inside your body. The fifth dynamic is memory and physiology. So when we remember past stressful events, the body replicates your physiological response. Do you ever go think about, like, when you were in high school or something, you smell somebody's perfume and you go back as if you're in high school, or you hear a certain type of music and you're back there? Like if you listen to the 70s or the 80s music, your physiology actually changes in such a way that these emotions become part of your memory store. It's almost like in your hard drive on your phone. Like you could take a picture that was back in 1999, it's still in your phone now. And it doesn't really matter when that thing was created. So if you were to do this long enough, if you ever to think about a lemon and you really visualize that, what would happen is you would actually start to salivate, right? And the reason why that is because your body is not really experiencing the lemon now, but it's experiencing the memory of the lemon. So a memory can actually elicit a physiological change in your body. And that's why NET is so critical with regard to balancing your system. So our body stress response works similarly when we're triggered with unresolved memories. Another dynamic is muscle testing with NET. It's been demonstrated that the muscle testing can access physiology of the body, including emotional response of that muscle, that will actually test and inhibit when you think about the past memory that's still stuck in your body. This is Dr. Dan Monti. I saw him back in 2013. He's actually one of the head psychiatrists in Jefferson Hospital that does neuroemotional technique, and he's one of the researchers that was really instrumental in getting us to, do the work. In NET, all memory events are considered emotional reality. What does that mean?
Emotionally, they're real, even if.
Yeah, whether they're real or not, it doesn't matter, because if you believe something to be real, it's in your emotional reality. It doesn't actually correspond with actual or historical reality. If you think about like a 3-year-old and they're scared of a monster under the bed, you could send the FBI over and do a research and give them a 50-page report. They're not going to care. They believe there's a monster under the bed. So if you believe it to be true, your physiology will reflect that, and it can affect your overall health. Muscle testing is never yes or no. It's basically it's an indicator. Instead, more like an emotional, like an involuntary reflex response, because your body will respond to it. And we actually have a whole seminar on NET, on muscle testing as well. For example, if you hit your patellar reflex, it's not something you think about. It's something your body just responds to because it's a reflex. And the same thing happens with the muscle testing. The seventh dynamic of the NET is semantic response, meaning that the physiology of the body can be reactive to the sight of a spider, for example, as well as to the word spider or a picture of a spider, and that's called stimulus generalization. And so the body can respond to a word or a picture or a thought of something, and your body will still have the same physiological response. Another dynamic of NET, the way it works, is like cures like. This is more in homeopathy. When we ask the patient to re-experience the emotions of the past, like anger or fear, within the context of NET, we're asking to go back briefly and relive a memory. And reliving the memory produces a feeling, and the feeling is like cures like component that helps the healing process. And also we use homeopathy. It's also sometimes used to allow the ongoing healing to happen. So emotions become embedded in your cellular body. So again, if you want more information on NET, you can go to netmindbody.com. Also, if you would like to, so let's do a little demo. Run up here. You've done this before, right?
Yeah.
So you can either enter through a body mode or an emotion mode or a feeling mode or a pain mode. So which would you prefer to do today?
I guess the emotional mode is the
Emotional
easiest.
mode. Okay. So is there something, you don't have to share this,
Mm-hmm.
Is there something you feel is bugging you right now, that like something personal?
Yeah.
Okay.
Okay.
So all right. So let's test there. What we're going to do is test the body and ask if there's that one is active. So lock the elbow. Can you think of that situation?
Yeah.
If it's too personal, you don't have to share it. But if it is, then okay. So think about that situation.
Got it.
And then so it's active. Put your hand on your forehead. And so when you do that and it stays strong, you're negating the weakness that tells you there's a neuroemotional component to it, meaning that it needs to be addressed on a physiological level. Relax now. Let's see what organs associated with it. Hold it and hold it. Keep thinking of that. And it's in the kidney meridian, which is fear, paralyzed will, miffed, timid, inefficient, wishy-washy, dread, bad memory, impending doom. Your emotion of impending doom regarding the situation. Does that make sense to you?
Mm-hmm.
Okay. So is that something you want to share, or is it better not to share?
Better not to
Okay.
share.
So think about that impending doom of that emotion, right?
Mm-hmm.
So your concept of impending doom, and what's the worst thing about the impending doom about that situation? What are you afraid is going to happen?
Okay. So just think about it?
Yeah.
Okay.
Or just generalize it. Like
Just
this.
to tell us, we're
this-
having a bad time too.
No, it's too personal. It's too
Yeah.
personal for her. So yeah.
Ours is real personal.
Go ahead.
Got it.
You got it?
Mm-hmm.
Okay. So then we asked about the concept of an original time when someone was feeling the emotion of impending doom because something bad could possibly happen. And that idea. The concept of an earlier time, there's not. So that's in the kidney meridian. So we found it now. You're going to put your hand there
Okay.
and put your hand on your forehead. and you put your hand flat on your forehead. This is how we make the correction.
Mm-hmm.
Bend your head forward, all the way down. I want you to close your eyes and think about that emotion. And as you're beginning to think about that, you're connecting the emotional meridian, the organ meridian where the emotions live. You're bringing it to present moment awareness, and you're touching the emotional point, and you're allowing the body to process that emotion that's stuck in there that otherwise would not be able to be processed. So what you want to think about now, Anna, is think about that and allow it to process. And that's going to go up and down in intensity from 0 to 10. You want to just allow it to process to your body until it gets to about a 1 or a 0, and we'll make the correction.
Okay.
So as you're thinking about that, what's the number now?
Probably 2 to 1.
2 to 1. Good. Turn around this way so we can show the correction. So
Okay.
the kidney meridian is T1, 5, and 8. So we're going to tap on those now that we're going to basically delete those files in the system. Take a deep breath. Breathe in. T1 and breathe out. And breathe in again. T5. Breathe out. And T8. Breathe in and out. Good. And relax and turn around this way.
Okay.
Now, what
Think
does
about that
mean,
now.
2 to 1. I don't understand.
She's talking about the intensity of the emotions that she's feeling. It went down to a 1 instead of a higher intensity. Any other emotion attached to this?
Because you did what you
We
did.
just cleared it. Yeah, we just cleared it. In other words, we deleted the files in an empty pathway. So think about the same situation.
Mm-hmm.
How does it feel now?
Better.
In what way?
More calm.
More calm,
Yeah.
right? So, I mean, the physiology can really rapidly change that quickly. It's almost like if you have like bad data on your phone, you have to make sure you address it. You have to go. So here's the difference between also just the psychological counseling, which really is helpful at some level. The psychological counseling, we talked about this before, about that's located in the neocortex. You're looking at the logical portion of your brain, you're asking questions, how you feel and so on. But again, the neuroemotional complexes that are stuck in your physiology are in the mammalian brain where the emotions live. So look at it this way. So the neocortex, let's say, is your hard drive on your phone, right? And it probably has like 16, 32 gigabytes and so on. It's the actual hard drive on your phone without you adding anything else.
Yeah.
So what'll happen is that the mammalian brain is your micro SD.
Mm-hmm.
You get it now?
Yeah.
So if you want to delete emotions that are stuck in here, you have to go through here.
Yeah.
You can't access it through here. So when you're just talking about things, you're using your neocortex or your new brain, and that's where the logical portion is, but the data is over here. So by doing the NET, you can access this information, delete the files. That's how behaviors change, and that's how the physiology of your body changes. Does that make sense?
Yeah.
Good. Thank you for
Well, how do
showing
you
us.
get rid of the negative outcome and make sure it comes out positive?
You can't change that. You just
Oh,
change
yes,
your
you-
physiology. You change your physiology.
That's why we're going here, right? You want to make sure it comes out positive, right?
Yeah.
You're not negative.
So if you want more
You can't
information, you
do
can
that.
contact us, drmariano.com, if you'd like an NET consultation.
So you can't help us for it to come out positive.
We can't change your behavior. We can
No,
change your
I mean,
physiology.
like
What do you
if-
mean?
Like she's upset about something that, it hasn't happened yet, but she's afraid it could
Mhm.
happen. That's how we are. Like we have something in the, and so we want it to come out positive. How can you?
You can't influence everybody outside of you.
Wow.
You can only influence who you are and your perception of it. So that's all that matters.
fine.
You're not here to change other people. You're here to change yourself.
Oh, I know,
Okay.
but we want them to, something bad to happen to them.
Yeah, that's something you will have to talk to a counselor for.
Oh,
Okay, that's not something that NET will
Talk to God
address.
about it. Right?
Yeah. So this is Dr. Dan Monti when we saw him in November. So this was 30th anniversary of NET. So I got taller than him. No, I'm actually kidding. He's really that tall still.
Is he the one that invented that?
No, he's the one that did the research for it.
he
Dr.
did.
Scott Walker is the one that invented it
Oh, he
back in
invented
1998.
Oh,
And this
really?
was just recent there. So some examples of problems that result from neuroemotional complexes or stuck emotions, you can actually affect your immune system. We already saw that from a heightened stress response or chronic stress, the allergies, anxiety and depression, cancer, autoimmune issues. Or 90% of cancers they're finding out is emotionally based.
You're kidding.
Pain syndromes too. I've had a patient here come to me that was referred to me by a chiropractic colleague of mine that lived in a different city, and she had already had low back surgery, and this was 10 years into later, and she was still having pain, and it was very severe, and nothing would help it, not even PT or chiropractic exercise, nothing would help it. So make a long story short, we did the neuroemotional work. It took us maybe 2-3 months or so to balance it out, and all the pain went away because it was never physically caused by the disc issue. It was basically, there was heightened stress emotions of chronic emotions in her body that were stuck that then allowed her to be able to heal.
Now, when it says that the cancer they're finding out is 90% emotional, is it like, say, if you get colon cancer versus skin cancer versus all different, is there any relationship?
Yeah, we talked about that in the beginning of the seminar. So basically what it is, when you have a heightened stress over time, which is a chronic stress, what happens is your body's immune system goes down, and that's what affects you to get the cancer. So it contributes to your immune system being low, and that's how the cancer happens, along with many other things that we'll talk about.
Not necessarily a particular type of cancer.
No. There's many other reasons for that. Yeah.
I see.
So relationship conflicts, repetition compulsion, that can also help with that, because then you can again get your perceptions to be cleared out instead of having misperceived emotions in your body. Other things are phobias. We take care of a lot of kids with phobias. We can take care of that naturally without any side effects. People that are dissatisfied with their jobs. We also have helped people with athletic performance. A lot of times people that are very highly athletic and they're trying to perform at a high level, we usually do things like I'm okay winning, I'm okay losing, to make sure they can reach their goals and not sabotage themselves. And again, we talked already the difference between counseling and NET. The counseling will help you on a rational level, on a conscious level, or the cognitive level, change your behavior, but the NET goes into the physiological portion of your body and deletes these physiological emotions that are stuck in your DNA. And the most important thing always is that, we want to be sure that the brain and nerve system are functioning optimally, because if you look at your brain and nerve system, it really coordinates the function of all tissues, organs, and systems in your body, and so the body can actually adapt to the environment. If you have 100% connection with your brain and tissue cells, your body has 100% function. However, when you have misalignments in your spine, the misalignments or subluxations can actually create tissue cell damage. The subluxations, by the way, are just as dangerous as cancer because you don't feel them, they have no symptoms. And a lot of times when your spine becomes misaligned, you don't even feel it because most of the nerves are not sensory. So you can have a very, very small misalignment. It's like when you go to the dentist, when you have toothache, that toothache didn't happen the time you had a pain in your tooth. That happened many, many months or weeks before because of the damage that's been going on in the past. So there's a lot of people out there, I know you guys online, that are suffering from anxiety and depression. And, we want to reach out to you guys to let them know that there's another avenue outside of the counseling and medications, that even though those may be something they may use, that you also need to fix the physiological problems that are being caused by these neuroemotional complexes. We always set aside 4 hours in our practice on a weekly basis for proactive health screening. What we do is, you can't just separate the body from mind and body. The whole thing is connected. So what we do is we check people's postures first to make sure they're balanced, because if you're crooked like this, if you alter your posture, you're going to alter the function of the body, you alter the function of the cell, you're going to alter the function of your physiology, and you're just not going to be happy. You're going to have too much tension in your system. So we check the posture, we put you on 2 weight scales to evaluate if you're balanced or not, because if you're asymmetrical like this, again, you're going to create high tension and chronic stress in the body, which affects your overall health. We also put you on a scanner called the surface EMG, where we put it on the back of your spine to get a reading if any muscles are spasming abnormally as a result of these misalignments in your spine. And the last thing we do, if we need to, is we take x-rays to look out for any degenerative changes, any types of arthritis and so on that may need to be halted at its path, or to be sure that it doesn't get worse. And their normal fee for examination is normally $280. The people that are here tonight, if you're interested in doing that, you can do it for $149 if you register tonight. And our next seminar is the 5 Secrets of Eliminating Chronic Pain, Your Last Glimmer of Hope. In our practice, there's so many people that have chronic pain, and if you already haven't read in the news the last several months, the opioid epidemic, right? Everybody's now addicted to these pain pills that are only supposed to be given at the end of your life. When you're already going to die, that's what opioids were designed to do. But since other people don't have other strategies how to get rid of the pain, they give this to you just to get you out of the way so that you can have pain relief instead of looking at the physical, emotional, and chemical. So our goal basically is to help people understand the principles. Where does pain come from? How do you cause pain? Is it physical, emotional, chemical? Is it related to diet? Is it related to your emotions? Is it related to exercise? Is it related to the nutrients you're taking? There's so many different reasons why that happened. And that's what we're going to be discussing next Tuesday. Those of you online, please like our page on Mariano Holistic Life Center on Facebook. And also get on our website, drmariano.com. And if you mention the word holistic, we'll actually give you the seminar rate to come to consult with us. So that's it for this evening. And basically, those of you that are online, if you found value in this video, please go ahead and give us a like. And those of you, if you have any friends or family members that are actually suffering that could use our help, forward this video to them, tag them on this. And also, if you yourself are having challenges and you've kind of hit your end of your rope, you've tried different approaches, different practitioners, and you're still stuck. And this is a very common thing that we see in our practice on a day-to-day basis. Feel free to contact us and to do a consultation and to see what we can do to help you so you can get your life back again. Again, I'm Dr. Dennis Mariano, and this is our Transformational Healing Seminar. We have this almost every Tuesday. We'll see you next week. Have a good night. Take care.